We're moving on to topic Tuesday. Okay. At any second, I know my door to my office is going to burst open because my dog hears this wind and she's going to barrel her way in here. Just warning. All right. This is from Duke. He is our medical, well, I can't even call him student anymore because he will be matching this week for his residency. So, this is my favorite time of week on TikTok and Instagram because I love watching the reels of everybody finding out where they match for medical school. I don't know why I get really excited, but I find this whole process so fascinating. And he will find out where he is matching for his residency, and we're super excited for him. And as he goes off to do this residency, we are also very excited to announce we're bringing on Samantha Colon, and she is going to be our new medical student. She is in her second year of med school now, and will be working along with Duke and Adam to bring us all of this wonderful medical information in such an easy to understand way. So let's see what Duke had to share with us. So today on the topic Tuesday, we were going to go over transcatheter aortic valve replacement, or TAVR, sometimes called, I guess, TAVI, or I've never seen that one, so I'm going to leave it with TAVR. So what is a transcatheter aortic valve replacement? TAVR, very different than TVAR, which we'll talk about another time. A transcatheter aortic valve replacement is a procedure that replaces diseased aortic valve with a man-made valve that is created from cow or pig tissue. We're not talking about mechanical, we're talking about man-made, okay? A TAVR is done to actually replace a narrowed or stiff aortic valve from a condition called what? Aortic valve stenosis. Not regurgitation, that would be a loose valve. This is a stiff, hardened valve, and that is stenosis. And so we do these surgeries to replace that valve when you have stenosis, and it's done through, it's done transcatheter, so it's done endoscopically, and we're going to talk about that in a minute. So here, if you see, we've got these formations. It's almost like a calcium deposit that you hear about that causes atherosclerosis, which would be hardening of a vessel. Here it is on the valve, okay? And what they do is they go up through either your wrist or your groin. We'll get to that because I'm not a doctor, so I don't remember exactly which way, but they do deploy a cow or pig valve. And here's your catheter with the balloon with the valve, and they're going to put it right in here and deploy that valve, okay? So let's talk about aortic valve stenosis. So the aortic valve sits between the left lower chamber of the heart and the aorta, which is the body's main artery. And now it is also its own organ. Let's not forget that. The valve problem actually blocks or slows blood flow from the heart to the body, which causes an opportunity to not have enough blood actually travel to all of the organs of the body each time your heart contracts. Because remember, all of that oxygenated rich blood gets to all of your body parts via the aorta. So if the valve becomes hardened, it's going to block the ability to have all of that blood flowing. So if your valve becomes stiff, then you have a condition that's called aortic stenosis. Your heart may have to work too hard to pump the blood through that small valve opening to the rest of your body. This could increase your opportunity for heart failure. That would be a major complication of not fixing or addressing aortic valve stenosis. So that's clear what the problem is that we have to fix, hopefully by TAVR. So for TAVR, you would have a team led by an interventional cardiologist and a cardiothoracic surgeon. Interventional cardiologists are typically the ones that you hear about that are they're going in and they're doing they're putting the balloons in and they're opening up your valves and they're going up and checking your heart from endovascular way. They're not cutting you open. It's all endovascular. So they insert this flexible tube. It's called a catheter, okay? And it goes into a blood vessel, usually the groin, the chest, or the wrist. Now, I've had this, not a TAVR, but I've had endovascular procedures twice, once through the groin and once through the wrist myself. It was just a heart catheterization. I know a lot of people that have scheduled surgery to replace aneurysms or repair aneurysms have a cardiac catheterization to kind of look inside the heart as part of a pre-op situation. And it's something that you're typically put to sleep. It's not a sedation like general anesthesia. It's usually done under Versed with a little bit of fentanyl to ease any discomfort. I would not say it was painful. I don't even think I really remember. I don't remember anything about the wrist. I will tell you that flat out. I don't remember until it was done. The groin was a little bit more uncomfortable when I woke up. There was a lot of pressure and I had a big lump there for about 2 weeks. The wrist, easy peasy, lemon squeezy, very easy. Um, so I was just amazed at the whole process. I'm amazed that they can do all of that from a little teeny catheter, but it basically, they guide this into the heart to the site of the aortic valve using an X-ray or imaging tools, which I did see that on the screen. So for the brief moment I was awake, I saw something on a screen. Could have been my liver. I couldn't tell you. I was so half in and out of it, but they watch that screen as they're guiding this into the artery up into your heart. And a balloon on the catheter tip will actually inflate. And it's it's how they use this to push the new valve in place. Okay, and afterwards, the catheter is removed once the new valve is securely in place. Um, and an aortic valve replacement can also be performed surgically with open heart surgery. They call that, I guess, SAVR, so surgically aortic valve replacement. But uh, TAVRs would be the newer procedure that they've been doing for years at this point, and that is to keep us from having to have our open heart surgeries performed. Now, if you have an aneurysm, probably not necessarily going to be a candidate for a TAVR. So it's not a guarantee that everybody gets a TAVR, and it's also not a guarantee that everybody doesn't. These are things you need to have these conversations with your physicians and find out what actually makes you a better candidate. So here we go. We've got trans aortic, trans, what is this? Trans apical. I'm not pronouncing these words right because I'm not too sure how to say it. This was be accessing through the tip of the heart. Transfemoral. This is where they do the access through the groin. Did I miss the wrist? Yeah, they don't have the wrist on here. Okay. Clearly, we can all assume that the benefit of a TAVR would be it's minimally invasive. It's not cracking open your chest, right? It uses much smaller incisions than open heart valve surgery. And people who have TAVRs often have a much shorter hospital stay than those who would have a surgical aortic valve replacement. It may be an option for people who can't have open heart surgery to replace the valve. TAVR can actually help reduce the symptoms of aortic valve stenosis, including chest pain and shortness of breath. So if you are somebody that has aortic valve stenosis, you really want to have these conversations with your physician, probably your cardiothoracic surgeon, about all possible options and determine which one you're probably a better candidate for and learn and understand why. This is just simply a very brief surface level overview of what a TAVR actually is. And if you have any questions about this, again, take this back to your physician and you would have a better chance talking to your surgeon. It's not typical to just call up an interventional radiologist and ask them this question. So ask your surgeon. If you don't have one yet, then talk to your cardiologist. That's your topic Tuesday.